We also have, on this show, viewers calling in with their questions on COVID. It's a worrying spike in infections, and we have a lot of viewers who've been writing to us, calling us with several questions. Jogeshwar Rao is dialing in from Hyderabad. Go ahead.
Good afternoon, Rishika, and panel of respected doctors. My question is about the second dose of Covishield. Why there is a vague guidelines about this particular thing? Initially, it was 4 weeks. Then modified guidelines is 4 to 6 weeks or 4 to 8 weeks, like that. But I took the first dose. I am 61 years old, and I am planning to take the second dose. According to the many experts over the TV, I decided to take in 12 weeks gap.
Okay.
So am I right? That is my first question. And second question is, what happens if people take much after 12 weeks?
Okay. Dr. Yatin Mehta, I think that's a very important question, and a lot of viewers have actually asked that question. What should be the optimum gap between the first dose and second dose of Covishield? Lots of different narratives as far as this is concerned.
No, Rishika, I think the instructions are quite clear. Initially, the evidence was in 4 weeks, or that's what the test in India, they had done the studies and came out with. So initial guidelines of the health ministry recommended 4 weeks duration. I had my second shot at 4 weeks, but now they have modified it and they have said around 6 to 8 weeks duration. So my advice to everybody is that 7, 8 weeks is fine. Get it done at 7, 8 weeks.
And
the second shot.
12 weeks is not fine, because 12 weeks is what's happening in the UK.
No, but the government has, the ministry has recommended 8 weeks, so you have to stick by it. Otherwise, you may not get a second shot.
Okay.
So I think 8 weeks is quite reasonable at the moment.
Okay. Stick to what the government in India has said, which is 6 to 8 weeks, and go and get your second jab in that time. Venu Gopal, next caller dialing in from Bangalore. Go ahead.
Hello.
Yes, go ahead.
Madam, I have to take a second dose of Covishield.
All right.
I'm thinking of taking it after 6 weeks.
Okay.
But there are recently reports floating that after 8 to 10 weeks is better.
Right.
So, I mean, should I wait till 8 weeks to 12 weeks for second dose, or can I go ahead with the 6th week after 6 weeks?
Thank you for your question, Mr. Venugopal. But I think Dr. Yatin Mehta has just answered that question, that the regulation in India, or what the Indian government has said, is that you should take your second dose between 6 to 8 weeks. So you should absolutely stick to that. But since we have so many callers dialing in about vaccine, dosing regimen for Covaxin and Covishield is different. This has led to a fair bit of confusion.
Yeah, I think the evidence came from the West initially in terms of a longer duration of an interval between the first and second dose might be more efficacious. So yes, this will lead to some confusion if you start comparing all the vaccines. My message is very simple to viewers. Please stick to the guidelines given by the local health center. Listen to your doctor. If he says, come after 6 weeks, go after 6 weeks.
Okay.
If they say 28 days, because once Sputnik comes, it will be even different. It will be 21 days.
Yes. All right. So I think that's very important advice generally. Don't believe everything you read on social media or get on WhatsApp especially. Listen to your doctor or to your medical health professional and go by what they say. We have Artam Bose dialing in from the Hooghly district. Go ahead.
Hello.
Yes, Mr. Bose. Go ahead.
I am Arpan Bose. I am 20 years old from West Bengal, calling you that why the government is not giving vaccines to the youth. Why? Because in my society or in my district, there are many cases who and persons who belong to 20 years old, who belongs to 28 years old.
Yes.
Why this government is not giving vaccines to us, the youth? Because because if the youth can't upgrade, but then the government can't be upgraded.
I think that's a another very commonly asked question. Dr. Babu, I want to ask you though, because this raises two important questions. One is that there is evidence to show now that younger population is getting infected. Several young people without comorbidities are falling very severely ill due to COVID. This is very different from what we saw in the first wave. Why is this happening, and how long before we can actually see a vaccine for the younger people?
No, in terms of eligibility for receiving vaccines, anybody who is 18 years and above is eligible to get the vaccine because the trial is done in the adults.
Yes.
Now, in terms of the supply constraints, we do not simply have enough vaccines to be able to give to everybody who is 18 years and above. The government is prioritizing vulnerable, and I completely agree with that prioritization because higher mortality is in the older age groups and also in those who have comorbidities. Coming back to your question, Rishika, in terms of the current wave, the virus will always find people who are susceptible, which means who are uninfected. And when you have an infectious variant, it will find more and more people who have not been infected so far. So therefore, young people, since they are interacting with the other members of the society, they are at higher risk of getting the infection.
Okay.
But among them, we simply do not know what proportion of them have comorbidities. What kind of immune system they have, we don't know.
Okay.
How do they respond to this infection, we don't know. Therefore, there is increasing morbidity also among the young people. We have to be careful.
You know, Dr. Chatterjee, would you like to come in there as well? A lot of younger people are getting infected and getting the severe disease. This is very different from what we saw, in the first wave. Why do you think this is happening?
See, these are still early days. What I am seeing is that this time, this wave, which is happening for the last couple of days, definitely the symptoms are more. There is higher grade of fever. They are more symptomatic than before, and there are less number of asymptomatic people that we are seeing this time. Obviously, the immune response of younger people is better than the elderly people. I would still think that the elderly people and the people with comorbid conditions have to be vaccinated first because their immune system is poor and they can succumb to the illness much earlier than the younger people who have a much better immune system and they can fight the disease well. This time, I think this is a virus which is slightly different, and only days and only the coming weeks would tell us whether it is a more deadly virus or not. We definitely know that this is an more infectious virus by a clinical experience, but whether it is more deadly or not, only time would tell us.
All right. Dr. Mehta, would you agree with that assessment that we know it's more infectious, it's more transmissible? We're seeing that in the numbers. But whether it's more deadly or not, we're not at that juncture to opine on it yet. We don't have enough evidence, for it yet.
I would fully agree that it is supposed to be the initial studies from UK showed it to be more infectious, that is spreading to more people. But regarding initial reports thought that probably it was less dangerous, that means it would probably kill less number of patients, that means less vicious. But that may not be true. I mean, the results of the data is not out as yet, but my impression is that it is not true. Our ICUs are full. That means enough number of patients are requiring intensive care, and patients on ventilator are also increasing. So I think mortality is also there. So it is not as benign as what initial impression was given, that it is more innocent. It's not, certainly not.
All right. So the virus is certainly not more innocent. Whether it's actually going to prove to be more deadly or not, one still needs to take every single precaution. If you're eligible to go out and get the vaccine, then you absolutely must do so. Thank you so much, doctors, for sparing your time and joining us.